Okay, so if surgery, remember surgery is not a part of transition for everybody, but if you're thinking about surgery as part of your gender transition, and especially if you identify as non-binary, it can be, I often find this working with non-binary people, it can be very difficult to decide which surgery to have. Reason being, because by far, a large number of non-binary people tend to oscillate, almost gender fluid-like, between different essences of gender expression. And the result for them, it can be very, very difficult to make a decision which surgical procedure to go with. So if you find yourself in this camp, it's going to be really difficult or challenging sometimes to make decision. Here's my tip. My tip is ask yourself if the surgical results you're seeking for is something you would be comfortable with regardless of gender expression. Let me give you an example. For example, if some of you would like to get mastectomy, which is removal of chest tissue, right, or flattening of the chest, or any kind of other elements of top surgery, because top surgery today for non-binary people is very, very diverse. It is whatever makes you feel comfortable. It could be also just complete removal of any breast tissue, including any presence of nipples, to have just completely gender-neutral chest presentation. So you have to ask yourself, are these outcomes, the surgical outcomes of having this particular chest appearance, is something that I just generally want, regardless of gender expression? Is it something that I generally tend to lean toward? And is that something that's going to make me happy in the long run? So looking at results and thinking about how the results will make you happy in the long run is one way of looking at it. Another example, this is not surgical, but it will illuminate this example even more. Some individuals who identify as non-binary may want to pursue facial hair removal process, right? Now, facial removal process is permanent. So how do you decide on the state of permanence? Well, you have to ask yourself, how do I feel about having facial hair to begin with, apart from gender expression and what type of gender expression it tends to communicate to the world? If you find out that facial hair is something that you don't like to begin with, you never really liked, on top of the fact that it's also causing you gender dysphoria, chances are that's probably a good direction to go into. So just keep asking yourself in general, how would you feel with the outcome? But usually for non-binary individuals, deciding on what elements of surgery to have as part of your transition can be challenging. And sometimes it's really just, just making the decision and seeing how it's going to pan out.